Good evening and welcome to the Gist with Jessica. From the last few days, Nigeria has been in the news because of its hotly conducted elections. And more oftenly, it has been in the news because of its statistics. The statistics that include the increasing population that is now competing with China and India. It's surpassing. The statistics which includes the unemployment rates among the youth in Nigeria. The statistics which include the poverty, the healthcare, and the education. And of course, the statistics which include the development projects that are led by the international institutions to increase the development rates in the country. Under these conditions that I just mentioned, there are several who dies every day. And of course, no doubt, the international media provide them enough space in the headlines. But they say, not the international media, but in general, that when one person dies, it's a death. When more than one dies, it's the statistics. And as I mentioned, Nigeria has been in the news because of its statistics. But today, we are not here to discuss the already existing numbers that are there in the news and the media, broadcasted by the international and global channels. But today, we are here to discuss what exactly goes behind these numbers, who makes up all these numbers, and what are the stories of people that are covered in all these numbers and statistics by the international media. And to discuss this, we have with us our guest, Ms. Dirisu, Executive Director of Policy Innovation Center. She has experience of more than 18 years in the areas of development in agriculture, education, and public health. She has led wide range of research implementation programs to reach out the vulnerable population in the country. And at the peak of the COVID-19 pandemic 2020, she has led development of National Gender-Based Violence Dashboard, an innovative data management and visualization platform for the coalition of validated and real-time GBP in Nigeria.
Yeah, so we can just start by a very small introduction of yours, if you can give your introduction.
Okay, I'm Osasuyi Dirisu. I'm the Executive Director at the Policy Innovation Center. Policy Innovation Center is based in Abuja, in Nigeria, and we do a lot of work around supporting, diagnostics and interventions with a behavioral focus to improve policy and program design in Nigeria and then soon across Africa.
That's so great. Very happy to know that. So generally I was looking into the healthcare, so that, because you have a lot of experience in the healthcare and the other development sector, also agriculture, because I was reading your profile and you have mentioned about the agriculture, healthcare, education, and reaching out to the vulnerable communities that are there in Nigeria and it's in South Africa also. So my first question would be, how is it to be a woman in Nigeria?
It's a very interesting one. I think that when you think about the typology of a Nigerian woman, you're thinking about someone who is strong, who is resilient, can go through pressure, go through thick and thin, to make a difference in the life of her family, in the life of her children, and in society. But being a woman, a Nigerian woman, is also very challenging. You may not always have that enabling environment to thrive. You may have to deal with a lot of social norms that limit, for example, the participation of women, meaningful participation in society. You may also have to address a lot of stereotypes and barriers. And sometimes when we think about these stereotypes and barriers, we only think about how that affects a woman in the rural areas. But no, even in urban areas, in offices, women face this existential barrier to access to opportunities, and that especially, for example, maybe in male-dominated sectors or in roles that are just generally considered more suited for men.
Yeah, thank you for your answer. Since you were mentioning about women and how it is in the society, how the society is responding to the women and what is the condition of women, even in the urban areas and the rural areas, right? So, and also in this context, we talk about a lot of public policies that are created for women so that we can encourage the participation of women, right? But when we talk about specifically the healthcare of women, even to be more specific about the maternal mortality rate in Nigeria that are increasing, given in the statistic, right? Do you think it's a more than a public policy issue, or specifically speaking, it's a social policy issue? Social, why? Because a lot of society perspectives also includes into this. Because when we are talking about the women health, the perspective of society also becomes important. How they treat women.
It's a combination of both. When we think around the burden of maternal mortality in Nigeria, it's a combination of both. So it's a public policy issue, but also a deeply embedded social policy issue. And one of the challenges would be addressing one and leaving the other. So, for example, in addition to all the issues around weak infrastructure, poor staff shortages for health workers, and all the issues relating to funding healthcare, looking for affordable funding models. We also have those deeply embedded issues, when we start to talk about education. Education is a very big issue. When you think around the level of literacy, access to information that women have, even understanding the benefits of healthcare access. And then you see these social issues also increase the burden of maternal mortality, because we have child marriage, early marriage arising as a result of gender roles or gender norms that place girls at the risk of getting married earlier than normal. And then you have all the other issues around decision making, joint household decision making. So who makes the call about a woman accessing healthcare? So even when she's in labor, she still needs to take permission sometimes from the husband before she accesses healthcare, and all the issues around gender-based violence, inequities in society. Then you're also thinking about issues that of course relate to the cultural perspectives. I remember a study we did some years ago, just trying to understand barriers to uptake to ANC, and it was really interesting to see that we had men who felt that they would not take their wives to the hospital if their wives couldn't be attended to by a female health worker. So if there was a male health worker in the facility, I'm not taking my wife there. And then even the birth position, we had some men say, oh, I'm only going to take my wife to the hospital if culturally a woman should squat when she has a baby and not climb on a delivery bed and lie. So when we think around issues relating to cultural beliefs, access to information, literacy level, these cultural barriers, for, hospital care, decision making, these are things that affect access in addition to all the other structural issues that affect the health system.
Since you were mentioning about the response of the men and how they act in such situation, you already answered my another question. But I still want to ask and want to take a deep dive into the third question that I have in my mind. Is, talking about the women and the early marriages of the girl that are happening. And, when I was reading your profile, you have mentioned that you have experience of more than 18 years in the development sector, specifically targeting the vulnerable communities. And when we talk about vulnerable communities, the woman comes first in that, in Nigeria, of course. So, given that the women do not have the economic equality in the Nigeria, they face a lot of problems in the childcare decisions related to that, even the decisions related to their own bodies, for example, the abortion rights, right? So even like you are working, and there are a number of organizations who are working to make the situations better. What do you think? Have the mindset of the men has changed over the time, or is it still same? What about the young generation, the young men that are coming up? What about them? What about their perspective?
Yeah, very interesting question. So a few years ago, we did some work around the context of rape in a region in Nigeria. And one of the things we did with all the social norms explorations was we broke the communities down. So we had young boys, young girls, older men, older women, because we're trying to really see how norms had transitioned to the younger generation. And so it was interesting to see that the younger ones were more open to information. They have access to the internet to some extent, even in rural areas. And so their thinking around how has been shaped, obviously, by that exposure. So I would answer this question by saying that it's mixed. So you have instances where you still have the traditional, male-dominated perspectives around decision making, around permission. Women not being able to engage in empowerment activities, not being able to own productive assets. But in terms of our programming and intervention, really one of the things that we have seen that makes a difference is early male engagement. So a lot of programs and interventions that have done well, whether for empowerment or for access to healthcare for women, even ending female genital mutilation or ending child marriage, have this strong male engagement component. So behavioral interventions that bring men on board from the beginning and get them involved in the conversations around, seeing the benefits, so it's mixed. We still have that very traditional patriarchal society where you have men, having the final say for many things, ownership of productive assets and the rest. But in designing interventions, increasingly we are getting that window of opportunity to change and make a difference by engaging men, very early on.
Yeah, I'm very happy to get your response on that. Since you were mentioning about the transition, right? And world is also transitioning to this phase of technology. Technology is getting everywhere in the education, development, healthcare. And the other organizations, the international organizations that are working in different countries like Nigeria and other third world countries, they are using technology at its peak, right? So even when you talk about the young generation, they have access to technology. That is why their behavior is also changing, like you were mentioning. Yeah. So how has technology helping women in their healthcare? Is technology having some kind of impact in healthcare decisions or their education or something? Is it accessible to women?
Thank you. So yes, it's helping to the extent that is available. We've seen a lot of proliferation around, using digital technology to impact on healthcare. We've seen quite a lot of innovation in the healthcare sector in the last few years. The challenge, however, are infrastructural, access to electricity, access to, to the infrastructure, access to mobile devices. Yesterday, we're talking about digital, the theme for the International Women's Day, and we're talking about some of the social cultural barriers that still limit women's access to owning a mobile phone because they don't have digital IDs or cultural beliefs that a woman who holds a phone could use the phone to do things that are not culturally acceptable. But having said that, I think that transition has come to stay. We've established the benefits. So although we're seeing that slow transition, I was involved in a project about 4 or 5 years ago where we tried to use digital technology to improve access to healthcare for MNCH in hard-to-reach areas. And we saw that health facilities, health workers were empowered, for example, through video trainings, tablets and internet connection made available in those facilities to educate women about issues relating to childcare. They could come into the clinic, engage the healthcare provider, and then use digital technology to learn more about issues relating to breastfeeding, relating to caring for their babies, relating to pregnancy and childbirth outcomes. Unfortunately, that project, we saw some challenges with sustainability that are linked to access to power, access to the internet penetration, and all the rest. But that transition, I think, is here to stay, and it's immensely beneficial for women to have access to information on the go. Get reminders for antenatal care, get reminders even for immunization of their children.
So this is happening same in the rural areas and urban areas, or is it only for the urban areas in Nigeria?
So, in the urban areas, there's some maturity. So in urban areas now, we have a lot of digital access for healthcare, reminders, appointments, counseling. So we have that. But even in rural areas, the project I just described was in rural and hard-to-reach areas across 3 states in Nigeria. So it's slow because of all the infrastructural challenges I've mentioned, but hopefully with bigger investments in digital technology and digital solid infrastructure, we hope to see a lot more of that benefits, translate to rural areas.
Yeah, thank you so much for your answer. So another question is also related to the technology, but more to the media. Why I'm asking this question, because I picked up this topic, healthcare in Nigeria, because Nigeria, when we search it on the Google or the YouTube or watch any kind of news, it's basically in the headlines because the election that happened recently, and after that the statistics that it tells, the unemployment that is there, and the population that is now increasing, which is surpassing the India and China also on the later stages. Earlier, India and China was in the news because of the population, but now Nigeria is there. Right? And a lot of the other stories that only international media is telling us, that this much of the investment is done in such project to develop people in Nigeria. And also media highlights the inhumane conditions for the workers that are there in the mining sector or in the oil industry. What is the story that you want to tell from the Nigeria? Because there are very few people who are telling on the internet the real stories that what is happening inside the Nigeria. We only have the perspective of international media that they are telling. But would you like to change that narrative or the story?
Yes, first of all, I really agree with you. I think that we should tell our stories more, balancing the challenges with the success, that we're experiencing. And I'm hoping that that's something, the more we take ownership for telling our stories, then the better we're able to change. I mean, we're not saying that we'll not acknowledge that we have challenges, but when we make progress, we want to responsibly acknowledge the fact that we're making progress, and then, balancing the challenges with progress made. And so we have made quite some progress. I mean, the IT sector in Nigeria, the information technology sector is highly developed. A lot of innovation is coming from the IT sector and improving the way we do business, improving access to cash, access to facilities for doing business online. We see also a lot of infrastructural projects coming up. In the last few months, we've seen one of the largest seaports, in the world, being built and commissioned in Nigeria. We've seen also one of the largest, oil refineries in Nigeria. Like I said earlier, there's so much innovation even going on in the health sector. We are not where we should be as a country. We have a lot of challenges, yes, but acknowledging the fact that we're making progress, in some areas that we hope would eventually translate to progressing even in other areas. But I think we should start telling our stories ourselves.
Yeah, I think so. So, talking about the stories and all, I would really love to know that what are the aspirations of the youth in Nigeria? What are they looking for?
I think the first thing that the young people are looking for in Nigeria is hope. Because, growing up, we've seen the good, the bad, and the ugly. But this current generation of young people have actually not been socialized into the level of, political instability, poor access to facilities, poor access to opportunities, it has ever happened. So we have a lot of gaps, in our education sector. In 2020, schools were closed for almost the whole year. So we've seen a lot of migration happen in the last 2 years, people migrating out of Nigeria to other countries to get opportunities. And the real reason is it's not just about not having opportunities now in your country. It's also looking into the future and not seeing the hope, not having no hope that things will improve. And as a result of those improvements, justify staying behind, for example, to aspire for some opportunity to get an education or get a good, well-paying job, to have a family, to be able to meet the basic needs, for your family. So I think that the biggest thing that is driving young people right now is hope. And the frustration that we see in them is as a result of that lack of hope. If you come out of school and you're still struggling to make ends meet, earn a living or get a good job or, a decent income for 2, 3, 4, 5 years, there's a tendency to feel hopeless. And as a result of that, think that the only solution may be a migration. I mean, the more we create that enabling environment for young people to thrive, to innovate, to use their skills to do things, then the more we'll give them hope and the aspiration they need and to even envision a better future in Nigeria.
Yeah, actually, I have a lot of questions, but yeah, we are bound by the time. So I really want to ask you the last question. Would you like to suggest any of the organizations for people who are interested to work in this sector?
That's healthcare sector.
Healthcare or in the development sector?
Oh, I mean, there are a wide range of organizations in Nigeria. From the international development partners. Most of the international development organizations across the global north, a lot of them are represented in Nigeria. So that's one layer. And then we have national development organizations, a wide range of NGOs doing work across the country. And then we have civil society organizations, at subnational, local level, also doing work. And there are quite a lot of directories online. So there's quite a wide choice. Unfortunately, like you have said, we have a large population, so we may have a lot more people competing for the opportunities. But I think opportunities emerge every day as a result of all the development challenges that we have in Nigeria. And I think that young people aspiring to work in the development sector can start by taking opportunities to volunteer or do internships, and then hopefully from there they can get into substantive roles.
Yeah, thank you so much. I think we are done with the questions. It was a really nice talking to you. I hope this discussion will change that negative narrative that people have around the Nigeria. I think we have discussed about the